Must be time for Dr. K, Dr. Kevin Cavanaugh. He's a retired physician and also the founder of a now becoming international organization called Health Watch USA. Good morning, Doc.
Good morning, Jack.
Tell us, first of all, let's start with Kentucky. How are we doing in terms of COVID? And then how are we doing in terms of monkeypox?
Well, be honest with you, if we were either going up or going down at our current level, there would be some hope that things would go away quite quickly. But unfortunately, we've kind of plateaued at this low but too high level of having just under 600 people a day hospitalized and under 80 people a day in the ICU with their test positivity rate of 19%. So Kentucky, although it is not where we want it to be, it is not like a top of the peak, but we're still in the red in Fayette County. And as far as I'm concerned, being over 65 and at high risk, I'm still taking precautions such as wearing a mask when I go inside, avoiding indoor dining, etc. And I think that's necessary to do. Monkeypox, we still have very, very few cases in Kentucky, which is good. As you know, this is spread by close contact, often by close intimate contact. And so Kentucky is still in relatively good shape. And I think with the vaccinations which are coming out and changes in behavior, that this pandemic of monkeypox is at least going to start to peter off and hopefully come under control. But right now, monkeypox has also plateaued, and it looks like it may actually be starting to decline nationally. What is distressing is that the United States has really dropped the ball on monkeypox, similar to COVID. For monkeypox, we have 36% of all the cases in the world. So that's not good. And I really do think we need to support our public health more and follow their advice.
What about polio?
Well, polio, so far, there have been no new cases, which is good. And of course, as far as paralytic polio is concerned, only about 1 in 200 to 1 in 300 polio cases will go on to that and likely be diagnosed as polio. But again, you've had huge vaccination campaigns in the affected areas, and so far, no new cases, even though wastewater has been positive. It looks like that also may be coming under control. But it's not going away by itself. It's going away due to public health interventions, and the key is vaccinations. I'll be honest with you, Jack. 40, 50 years ago, people were talking about you have to get vaccinated for polio. I went through medical school. I went through residency, training, and then, of course, practiced medicine for many decades. I thought this was a disease we would not see again, and lo and behold, we're back talking again about being sure you get vaccinated for polio. So vaccines are key for COVID and for polio, and if you're at high risk, also for monkeypox.
What else do we need to know this morning, Doc?
Well, there's a couple of things. One is that the federal government is not going to be paying for vaccinations, testing, and also treatments for everybody. Now, you'll still be able to get this through your insurance, but that may, be a couple of hoops you have to jump through. And so I'm not 100% sure how that's going to work out. But as far as walking into Walgreens and getting a test, no questions asked, that may start to be phased out come fall and into next year. And that's because of lack of funding. However, right now, you can still go on to covid.gov/tests and order your COVID tests. And I think that is just key. Make sure that you've done that. And if you've got insurance, you want to go on ahead and get your free tests, which you can get every month. If you've got Medicare, you just have to call up to Walmart or Walgreens and say, I've got Medicare, here's my Medicare number, and they'll give you 4 boxes of tests, which are equal to 8 tests, and that's once a month. You can not only test yourself, but you can make sure that others are safe around you, such as if you have a grandchild coming over to visit you for the weekend and kind of put a bubble around yourself. Of course, That grandchild should also be covered by insurance, and the child can also get their free tests. So I do encourage people to take advantage of that program. I think that that is key.
Very good. As always, we appreciate you very much. Thank you, Dr. Kevin Kavanaugh, sir.
All right. Thank you very much.